What is cystoscopy? Cystoscopy is a common procedure that allows your physician to examine the anatomy of your bladder and urethra and is used to diagnose, monitor, and treat conditions affecting these areas. There can be many reasons why your physician has recommended a cystoscopy. In some cases, a cystoscopy is done to investigate the causes of blood in the urine, overactive bladder, incontinence, and painful urination. It can also help determine the cause of frequent urinary tract infections. In other situations, the procedure is used to diagnose and treat bladder diseases as well as diagnose an enlarged prostate. No matter what the reason, the procedure is very common and takes only 2 minutes to perform. The procedure: a flexible fiber optic telescope is lubricated and inserted into the urethra, allowing the physician to see the urethra and check for any abnormalities. The scope will then pass through into the bladder to look for polyps, tumors, or any other irregularities that may be causing the urinary problem. In order to get a good view of the bladder will be filled with saline. A patient may feel the need to urinate, which may cause minor discomfort. The more relaxed a patient can be, the easier and less painful the procedure will be. Again, the procedure only takes about 2 minutes. Results of cystoscopy. Following your procedure, your physician will discuss your results. If a biopsy is required or your physician needs to remove any abnormalities, a follow-up appointment will need to be made. Risks and complications of cystoscopy. All patients must urinate before they are released to go home. You may experience some side effects after cystoscopy, such as bleeding from your urethra, a burning sensation during urination, and more frequent urination for a few days. This is considered normal, and symptoms are generally mild and will gradually decrease over time. Cystoscopy can introduce germs into your urinary tract, causing an infection. Risk factors for developing a urinary tract infection after cystoscopy include advanced age, smoking, and unusual anatomy in your urinary tract. Other risks include a chance of injury to the urethra, like perforation, and scar tissue, but those are rare. Call your physician or go to the nearest emergency room if you experience an inability to urinate after cystoscopy, bright red blood or heavy blood clots in your urine, abdominal pain and nausea, chills, a fever higher than 101.4 degrees Fahrenheit, or pain or burning on urination that lasts for more than 2 days. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure. Your nurse or physician will be with you shortly to answer any further questions that you might have.